Hello, I'm Dr. Austin Chiang today. I want to talk about the anatomy of the appendix, and more specifically about pain that arises from it. Appendicitis, which is inflammation of the appendix, has a fairly classic pattern of pain. It typically begins around the umbilical region, around the belly button, and then shifts toward the lower right side of the abdomen. Why does this happen? The explanation lies in the anatomy. As we go through it, we will also uncover some interesting anatomical details that help explain other features of appendicitis. Understanding the anatomy of the appendix. To understand appendix pain, we need to examine the anatomy of the appendix, the nerve supply, innervation of the appendix, the role of the peritoneum, locating the appendix. The appendix is found in the lower right quadrant of the abdomen. To find it, we first identify the cecum. The cecum is the first part of the large intestine and marks the beginning of the ascending colon. It is a blind-ending pouch that receives contents from the small intestine via the ileum through the ileocecal valve. The appendix extends from the cecum. If the gastrointestinal tract is a tube, the appendix is a small, narrow tube branching off from it. The point where it attaches to the cecum is fairly consistent in most people. The full name of the appendix is the vermiform appendix. Vermiform means worm-shaped and appendix means an attached structure. It is typically about 6 to 10 cm long. Although it reliably arises from the same place on the cecum, its direction can vary. About 70–75% of people have a retrocecal appendix, which lies behind the cecum. Around 20% have a pelvic subcecal appendix, which points downward. A small percentage have other positional variations. These differences can influence how appendicitis presents clinically. The appendix is a hollow tube with all the typical layers of the gastrointestinal tract. It contains a significant amount of lymphoid tissue in its submucosa. While it is not essential for survival and can be surgically removed, it likely plays a role in immune function. It may also serve as a reservoir for beneficial gut bacteria, helping repopulate the intestines after illnesses that cause diarrhea and vomiting. What is appendicitis? Appendicitis refers to inflammation of the appendix. Because the appendix connects to the cecum through a narrow opening, this passage can become blocked. In adults, this is often caused by a fecalith, a hardened piece of stool. In younger individuals, enlargement of the lymphoid tissue inside the appendix may block the lumen. Once blocked, the appendix becomes inflamed. The pressure inside increases, blood supply may be compromised, and the tissue can become necrotic. Cells begin to die. If untreated, the appendix can rupture, releasing inflammatory material into the abdominal cavity. This leads to widespread peritonitis, which is far more serious. Recognizing symptoms early is therefore very important. Why does the pain start near the umbilicus? This is where embryology and nerve supply become important. Embryologically, the appendix is part of the midgut. Its blood supply comes from the superior mesenteric artery, a branch of the aorta. The appendicular artery arises from this system. Nerves follow blood vessels. The appendix receives autonomic innervation, not somatic. This includes sympathetic fibers from thoracic spinal levels, parasympathetic fibers from the vagus nerve. These nerves form the superior mesenteric plexus. Sensory fibers, visceral afferents, travel back along these pathways to the spinal cord. The key point, pain signals from the appendix enter the spinal cord at the T10 level. The skin around the umbilicus also sends sensory information to the spinal cord at T10. When the brain receives pain signals entering at T10, it cannot clearly distinguish whether they are coming from the organ, visceral pain, or the skin, somatic pain. Because the brain is more accustomed to interpreting signals from the skin, it interprets the pain as coming from the umbilical region. This phenomenon is called referred pain. So early appendicitis causes vague, poorly localized pain around the belly button. Why does the pain shift to the lower right quadrant? To understand this, we need to discuss the peritoneum. The peritoneum is a thin serous membrane lining the abdominal cavity. It has two layers, visceral peritoneum, which covers the organs, parietal peritoneum, which lines the abdominal wall. The visceral peritoneum does not detect pain precisely. It is sensitive mainly to stretch and irritation and produces vague discomfort. The parietal peritoneum, however, has somatic innervation, similar to the skin. It can detect pain, pressure, temperature, and damage with much greater accuracy. As appendicitis worsens, inflammation spreads from the appendix to the nearby parietal peritoneum. Once this happens, the parietal peritoneum sends well-localized pain signals to the brain. At this stage, the pain shifts from the vague umbilical region to a sharp, localized pain in the lower right quadrant, where the appendix actually lies. This explains the classic progression of appendicitis pain. The psoas muscle and additional signs. If the appendix is retrocecal, behind the cecum, it may lie close to the psoas major muscle, which is a hip flexor. When someone flexes their right hip, the psoas muscle contracts and can rub against an inflamed appendix. This can worsen pain. This is the basis of the psoas sign, which can help in diagnosis. Important clinical note. The pain pattern described above is the classical presentation. However, because the appendix can vary in position, symptoms may differ. An unusually positioned appendix may produce atypical pain patterns. This is why careful clinical examination is essential.